The Regional Sexual Reproductive Health and Rights Fund is a regional funding mechanism that was set up in 2010 by Hivos Southern Africa and Ford Foundation to strengthen sexual reproductive health and rights work within East and Southern Africa region. The fund was established in recognition of the critical need for a strategic regional response to collectively address the myriad of SRHR issues in Southern Africa, with particular attention to young people and adolescents.
Hivos sees young people as not only the leaders of tomorrow, but the emerging leaders of today. And we prioritize their rights and needs, particularly also focusing on sexual and reproductive health and rights. And what we're doing as Hivos to prioritize their sexual and reproductive health and rights needs is to ensure that first and foremost we bring them front and center in interventions that seek to save them. For example, we are implementing the Regional Sexual and Reproductive Health and Rights Fund. And through this implementation, because it's focusing on adolescents and youth in East and Southern Africa, we have ensured that young people are front and center in how we designed, how we will implement, and all other aspects of the program. So we do have what we call a youth advisory panel, where we have young people, representation of young people in all their diversity, because we don't believe that young people are a homogeneous group. So in all their diversity, representing and inputting and really bringing the ideas and informing the decision and the frame of the program.
As a youth panel advisory member, I see the SRHR fund giving me the tools, the platforms to be able to implement different programs, as well as having a say on what projects and programming will speak to the Zambian people, as well as Zambian young people in terms of SRHR and advocacy. Away from that, implementation and learning from different regions of what can work, including cooperative partners from the different regional stakeholders.
As a representative of the people and as a youth member of parliament, I've got a very big role in ensuring that the young people live in a healthy environment, and also issues around sexual reproductive health of the young people are safeguarded. One of the roles of the member of parliament is oversight function, and as a member of parliament who represents a larger population of the young people, my role is to see to it that the government that is supposed to provide services to the young people, it does that. I ensure that in the clinics, I see how sexual reproductive health services and information is provided.
We also see that our tradition and culture shuns away or has particular perspectives about adolescent sexuality. So in our socialization, we find that sometimes we do not provide comprehensive information for young people to be able to make informed choices regarding their sexual and reproductive health. We see a lot of poor health outcomes because first and foremost, young people are disproportionately impacted by various factors. Poverty, for example, gender inequality, climate change and its related disasters and impacts. So there's definitely need for us to intervene around youth sexual and reproductive health and rights. If we were able to do that and promote access to sexual and reproductive information and services, to intervene much earlier, then we will be able to ensure that there are better health outcomes, they have access to education and other opportunities, and as they grow, they are contributing effectively to national development.
The key SRHR issues in Zambia are access to information, access to services when it comes to SRHR. Zambia is a wide tribal country, and so the information doesn't really run down to the smallest groups in terms of accessing information in their local language. So that becomes a big barrier and a limitation to accessing that information, accessing that service, as well as having limited commodities and far health facilities in different localities. And I see the regional SRHR fund incorporating such into their programming, incorporating more locals, incorporating programs that will help young people not be parented when they go to access the services.
as Hivos, and also particularly through the Regional Sexual and Reproductive Health and Rights Fund, we work with multi-actors. So we work with government to ensure that there are laws and policies in place that are progressive towards adolescent and youth sexual and reproductive health and rights. We work with policymakers that they ensure that the laws that are passed are also progressive enough.
There's a lot that needs to be done in terms of access to information, access to services, and ensuring that, there is a fair playground for adolescents to be able to access the different services. As you may know, particularly Zambia is among countries that are having high rates of teenage pregnancies. We also have issues to do with ensuring that there is access to services, which is actually a challenge. For example, when a young person goes to a health facility to access family planning services, they are looked at as though they are asking for something that they should not ask for. So we need to ensure that our policies, our strategies, and indeed how services are provided with regards to sexual reproductive health is inclusive of the young people.
Young people have voices, and it's high time that the government, civil society organizations, and cooperative partners understand that young people are now going to school, are getting an education, and should not merely be seen as representation, but given the right tools, given the right platforms, they are able to deliver in ways that drive the change.
Hivos has been a very good partner, not only to members of parliament as champions, but also it has been working very close with the Zambian Parliamentary Caucus on sexual reproductive health. I would want to mention that the establishment of this caucus, it comes with the blessings from Hivos. Hivos has been one of the key partners in the process that saw the establishment of this caucus in Parliament that has about 54 members. And these parliamentarians are working as champions on sexual reproductive health and rights.
Hivos was our second grant that we got, and we saw the organization benefiting from the capacity building in ensuring that we have the strength to be able to implement our activities, but also the organization to grow in terms of its governance system and how we ensure that we're not just ready to benefit from the fund, but also to expand in our work. And from that time, I think as SRHR we've grown to reach different parts of the country. I think we're a membership organization and we have members in all the 10 provinces, but also now we're reaching out to different regional countries. And so this has been because of the support that we got from Hivos, and indeed the impact has been positive.